Hi everyone, I'm back again. Thanks for watching. I want to talk about soy or tofu and hot flashes. Okay, let's go. Okay, probably you've heard about flashes or flushes and you tend to be confused. What are they talking about? Is it all not the same? And so on and so forth. Well, a flash is a sudden burst of something. Okay, why flushes is a kind of situation when you become red and hot as a result of illness or a strong emotion. If we sum up these two definitions, we can just say we're having a sudden burst of redness and hotness secondary to decreased estrogen as a result of menopause or premature ovarian failure, or as a result of iatrogenic causes like surgical intervention where the individual had undergone bilateral ovarectomy in the past, probably as a result of ovarian cancer or ectopic pregnancy 2 times affecting the ovary or ovarian abscess. So whatever might have led to the natural decreased level of estrogen in this woman will give us what we call hot flushes or hot flashes as some would define it. Okay, let's go. Seeing is believing, right? Tofu. I have a personal story of personal experience of a woman who had used tofu because she's running away from hormone replacement therapy. Let's go. She has been advised to be taking tofu every alternate days. She came back with a report of improvement in symptoms, but the drawback had been that a quick relapse will occur once she stops or misses not taking the tofu in 2 or 3 days. Well, I didn't have any idea with that because tofu is a plant-based therapy. And I need to make a declaration here right now that I'm not an agent of the company that has produced tofu. No, I don't even know them. And if I have any contact with them, they can leave message here and make the proof. So I don't have any connection with any company in any way. But I'm just passing to you what has worked for someone. Okay. Some experts also agree that soy is good, but they are not supporting supplements. So I'm not campaigning for supplements here right now, but I'm pretty much okay with soy that's pretty based as plant therapy. Okay. Um, Soy contains isoflavones, Genistein, and daidzein. They are very potent phytoestrogens, though weaker than human estrogens. Genistein greater than 30 milligrams per day may be beneficial to reduce hot flashes. The phytoestrogens are selective estrogen receptor modulators, so they have anti-estrogen and pro-estrogen effects, if you will. That is, if you agree so. In other words, they have agonistic and antagonistic effects. Other than soy or tofu, there are other non-estrogen containing substances or behavioral modifications that any menopausal woman may adopt while running away from hormone replacement therapy. And as a matter of fact, my priority would be to explore all those before getting down to more replacement therapy. You can use air conditioning, AC, or fans, or you dress in layers. So when you are hot, you remove some of the layers. When you are cold, you add the others. And no spicy food. Mm. Decrease stress in any form, physical stress, and if you can find your way to decrease emotional stress, that will be helpful as well. Get down to the business of weight loss, cognitive behavioral therapy, and vitamin E at low doses. In severe hot flushes, because all I've said before now is about mild to moderate situations, okay? So in severe hot flushes, you're afraid to look for something stronger to help the affected woman, right? So Bazedoxifene with conjugated estrogen are combined, okay? The tissue selective estrogen complexes will contain Bazedoxifene as a form of selective estrogen receptor modulator with a conjugated estrogen. The combination will have estrogen agonistic effects on the bone and antagonistic effect on the endometrium and neutral effect on the breast. The estrogen deficiency effects are corrected, okay? While the side effects of progestins are avoided completely. So, no breast tenderness, and there will be decreased chance of endometrial and breast cancer. This would decrease hot flushes by about 75% or even more. Isn't that great? So we can consider Bazedoxifene combined with conjugated estrogen. If you've not heard about that before, you can start that or take this presentation to your physician, and your physician will figure that out with the, they are knowledgeable, they are current, they know everything. So you are just hearing about this for the first time, right? It will help you, okay? Particularly when we're running away from the side effects of estrogen and combined estrogen progestin hormone replacement therapy. Still not comfortable with what I said in the last 7.5 minutes? You want to try non-hormonal, medications, um, aside tofu, soya, Bazedoxifene with low dose conjugated estrogen. Yeah, you can try selective serotonin reuptake inhibitors. Paroxetine, citalopram, sertraline, fluoxetine will be available for you. Okay, and you can try serotonin norepinephrine reuptake inhibitors. Lanfacine and desvelanfacine will be available. Still not okay. You can try anti-epileptic drugs like gabapentin or pregabalin. Clonidine is a centrally acting alpha-2 agonist, but be very careful here because of possible severe hypotension. And that's why it's given at very, very low dosage. Oxybutynin is an oral anticholinergic agent primarily meant for overactive bladder, but very helpful when it comes to menopausal hot flushes. Okay, let me talk about KNDY, but I'm not talking about Kennedy. Okay, centrally acting neurokinase receptor antagonist would be a very good medication to suppress hot flushes. And you ask me why that? Kiseptin neurokinase B dynorphin neurons will innervate thermoregulatory center in the hypothalamus. The KNDY, that is combination, is stimulated by neurokinase B, and inhibited by estrogen. Lower estrogen means there is increased stimulation and therefore the thermoregulation is lost. Remember, I've just said that the estrogen component is expected to inhibit that stimulation, okay? While neurokinin B will stimulate in the thermoregulatory center right there in the hypothalamus. So when a woman is feeling the hot flushes, the estrogen is expected to block that and cool it down, okay? But unfortunately, at this stage of our life, menopausal stage, there's a low level of estrogen. So there is increased stimulation, and that is not inhibited at all, or it's just being inhibited to the barest minimum, so it's not effective. So the thermoregulation is lost. That is why the woman will feel the hotness so severely within a few minutes, and it's going to go down again. The antagonist of neurokinin B at neurokinin 3 receptor will be an excellent replacement of hormone replacement therapy. Isn't that good? Then that's a great news, right? Well, someone will leave a message, where can I get that? I'm not selling any medication, of course you know that. I'm just passing this information to let you know what is possible in medical field. So don't ask me where you can get it. Discuss with your doctor, but I can tell you he's not going to be able to prescribe it also. Why that? It's still on the way. It's not yet out. So, chill. Sorry about that. Still on the way. So be on the lookout for that. You can still go ahead, having some stuff done without having hormone replacement therapy. Cognitive behavioral therapy. Apps are not offering any opinion here. I'm not. Okay? Contact your pharmacist, contact your doctor as far as herbs are concerned. You have many items to choose from, okay, besides hormone replacement therapy. And the reason is I'm just so concerned about the possible side effects. You have tried soy or tofu, or you've done everything, double layer clothing, air conditioning, fans, you've done everything, and you're not winning. You've tried, SSRI, you've tried the vaccine, and you're not winning. You've tried anti-epileptic medications, you're not winning. Before you begin hormone replacement therapy, particularly for a woman who is not interested, let's check some stuff out. Are we missing the diagnosis here? So let's check out the differential diagnosis. Okay, then we need to go back to history of alcohol in this affected individual. Without being judgmental, we just has about hot drinks and come down to possible emotional stress in our life. Okay, any anaphylaxis here just has that history, and of course, the physical examination will reveal that as well. I've just asked about alcohol, the rate at which this woman is now taking the alcohol, the quantity, and the frequency. And I have a carcinoid syndrome with all the signs and symptoms of it, and pheochromocytoma somewhere with sudden headache, heart racing, that is tachycardia or palpitation, and sweating profusely. Even hypothyroidism, right? Hypothyroidism or even panic attack. Okay, how about bromocriptine? Is this person on bromocriptine? Is she on levodopa? Any endocephalic seizures here. So we need to rule out all these other possible differential diagnoses and even more then before we start working on hormone replacement therapy, particularly if it's a severe situation or we're not winning with all these non-hormonal interventions. And with that, I've come to the end of this short presentation. Kindly go over it. I hope it's going to be helpful to so many women that will definitely reach this age in their lifetime. Thanks for listening to my presentation. Kindly subscribe to my channel so that you can get my presentations immediately they are published. Thank you. I appreciate it.